For 5 days now, workers in one of the most critical sectors in the nation, I'm talking about the health sector, have been on strike. Now, put this in context, 16,000 doctors have withdrawn their services from a sector that we have always said does not have adequate manpower, adequate equipment, facilities, and the rest. So imagine 16,000 doctors withdrawing their services. I mean, this story will probably be better told by patients who have had to go to those hospitals and were probably turned back because there was no one to attend to them, or at least the staff on ground were not enough to attend to their health needs. Don't forget, this is a matter of life and death. So this is a major concern, 5 days. And this morning, we're trying to demystify the issues. Maybe a solution is on the horizon. And as you have seen, we're being joined this morning by Professor Innocent Uja, who is the president of the Nigerian Medical Association. He joins us virtually from Otukpo in Benue State. And we'll also be having Dr. Arome Christopher Adejo, who is the first vice president of the Nigerian Association of Resident Doctors. He will be joining us from our Abuja studio. So, gentlemen, thank you for joining us. But let me begin with Professor Uja, because, I mean, you are senior to these doctors. You have been in the field, the industry for years now. And it begs the question, first, what does the NMA think of this strike? Because for the resident doctors, they're fighting against the rot in the sector and they have their demands. But for the NMA, what is your view of this strike? Are you in support of it or you have your reservations?
I don't see the rationale for that question. In 1985, the Nigerian Medical Association said that hospitals became mere consulting clinics. That statement still holds today. It is very sad, and I'm indeed very sad, that a lot of people in government functionaries are misinforming the system and the government. In fact, I believe that some of them are even sabotaging the efforts of Mr. President. Otherwise, how can we be going round and round like this? These are things that have been on the drawing board for some time. Agreements were signed. Nothing happens once the industrial action is suspended. I mean, for the Minister of Labor to make that statement that he made, he's my very good friend, but I'm very disappointed at what he said, to the effect that the Nigerian doctors have been paid with so much money, and America and the UK, you have to pay to do residency. That is complete lies. I would have said it's a misinformation and disinformation. And indeed, in fact, it's a hate speech. I don't expect a very respected Minister of Labor, a former governor, a former senator, to make such statements, because his statements will appear to be law when he makes a statement. A former governor, a former senator, and now minister. Now, how would anybody take what he says seriously? So by and large, my own feeling is that there are some people who want to sabotage the effort of Mr. President. And such people should either they are tired or they are unwilling. And the best way to respond to those issues is to probably quit, because they are not telling the truth. Doctors, patients, in fact, patients are suffering. It's not an issue of whether you are for or against the strike. The level of rot that we have in the system is so bad. And we believe that we have people like Chris Ngige. What is the Federal Minister of Health doing? They are quiet, as if it doesn't bother them. I expect the Federal Minister of Health to respond appropriately to this. There was COVID. Doctors and other health workers went to the field to prosecute this war. Issue of hazard allowance came up. It was treated with levity, except for the intervention of the Honorable Speaker of the House of Representatives. Things wouldn't have come this way. And they paid this money that was pittance, was paid for just 3 months. And that was all. Meanwhile, people are fighting to contain the COVID-19 pandemic. As I'm talking to you now, since June, nobody, no doctor, no health worker has received any COVID, hazard allowance.
Okay, Prof.
And this is the period of war as far as health is concerned. So
okay,
my
Prof.
statement, my feeling is that, yes, please, my statement is I think that the functionaries of government are very unserious.
Okay, Prof, I still don't think you answered my question regarding your view concerning NARD's action. You have spoken largely about the government's action, how the minister has responded. But, this approach taken by the NARD, is NMA in support of it? Because I believe the NARD will be looking back to see who's in support of us since we're fighting for the health sector. But hopefully when we return from this break, we'll get you to respond to that question and some other burning issues. So please, join us again. Professor Innocent Uja is still with us. He joins us virtually from Benue State. And just before that break, you were responding largely to what you have seen the government do, especially the Minister of Health. But now to the NARD, the resident doctors, their actions. I believe they look up to you for advice, for, guidance as to how to go about issues, which is why I asked, are you behind them on this strike action?
Respect. It's a rhetoric question. House officers have been working since January. Is there any reason why they should not be paid? These are people who work for 24 hours. The insurance, life insurance in the period of pandemic, why should health workers, Nigerian doctors and health workers not be covered with life insurance? Why should there not be a COVID allowance, a health hazard allowance paid? The reality is that we've been trying, 4 weeks ago, 6 weeks ago, I advised that the Federal Ministry of Health and Labor should better address these issues of the resident doctors. We've been going around, we've been trying to see how we can resolve this without anybody knowing. And we're going behind the scene, we've been discussing, we've been consulting, we've been negotiating. But the truth is that it doesn't appear that the functionaries of government are prepared to do anything. Otherwise, we shouldn't come to this mess. I believe that this should have been settled long time ago. So why is it that the functionaries of government, Minister of Labor and Employment, the Minister of Health, will keep quiet until there is a strike action? Why should doctors not be paid? House officers, these are people who are coming into the profession. After a series of strike, they couldn't graduate. They eventually graduated. They started there. They waited for months, if not years, to get a place for house job. Now they got a place of house job. They were doing their work, and unfortunately, they couldn't be paid. And it's just purely administrative lapses. It is not to say that there's no money for them.
Prof, you know government well. You were a former DG of NMA, so you understand how these things work with government. And it begs the question, just like you are asking, a lot of Nigerians are asking, just how hard is it to solve these challenges? This is a very vital sector. This is a sector that concerns the lives of millions of Nigerians. So, having worked with government, do you still think there is an excuse, really, for governments to keep lagging behind when it comes to meeting these demands, which, honestly, there are a number of them?
You see, when you say government, it's very easy to say government. The governance it's a delegated responsibility. So when we say government, let's say this time, Minister of Labor, and very clearly, and also Minister of Health, are we going to say that it's the fault of the president? I expect the president to call them to order, because they are drawing Nigerian health system into the mud, and it's not very nice. We should not be talking about, we're talking about improvement in the health system. We're talking about reversing brain drain. where we should be talking about how we can improve medical services so that we can then have medical tourism in Nigeria. Not every day you're talking about qualities for doctors and other health workers, or house officers are not being paid, or equipment is not there. The situation is very bad. And it is you in China that probably think that health facility is a critical factor. I don't think that those who are charged with the responsibility think that is a critical factor. Otherwise, we shouldn't have come to this mess. That's the way I look at it.
Well, I'm
The
pretty
level
sure.
of unseriousness demonstrated is very painful.
Well, I'm pretty sure, the fact is not lost on anyone in Nigeria, whether in government or not, how critical health infrastructure is. If health is critical, certainly the infrastructure will be as well. But then, pay is just one of the issues being raised by the NAR. They will soon go to Dr. Arome in our Abuja studio, but other issues have been raised by them, Prof. They have talked about implementation of the September 2017 memorandum of terms of settlements between NARD and the federal government in order to bring lasting peace to the health sector and curb the ugly trend of brain drain from the health sector in Nigeria, as well as the immediate review of the act regulating postgraduate medical training in Nigeria. Take a look at that last one, Prof, the one that talks about regulating postgraduate medical training in Nigeria. A good number of people are wondering what exactly is being talked about there, and not once or twice has the name of the MDCN, the regulatory body of the health sector, been mentioned in all of this melee. What do you make of it, and how did we get here? How do we ensure we never go back there? Professor Uja, that's for you.
Yeah, how did we get here? We know why we got here. We got here because we are unserious. Things are not taken very seriously. The issue of the review of the act is not something that it should be done immediately, but it can be put on board and we see the process. That is a process. Is it difficult to pay house officers who have been working for 3-4 months? Is it possible? Is it difficult to pay health workers, including doctors, COVID hazard allowance? Is it difficult to pay those who have been working, resident doctors who have been working and have not been paid? Tell me what is difficult in this.
We
Unfortunately,
recognize,
I feel very sad.
Yeah, we've talked about that one, but I'm talking about the several times that the Medical and Dental Council of Nigeria has been mentioned in all of the conversations. How significant is it, in the first place that, this issue with the MDCN is coming as far as the NARD is concerned? What should be done? How did we get to the point where the MDCN is being mentioned by the NARD about this matter? How do we ensure that we don't get back there again?
Well, I don't know. I think the issue of MDCN is a recent event. It's not something that has been on. Probably it will reorganize the place. That has been on. But the issue of the MDCN is the issue of placement for house officers, whereby some are being paid, some are not being paid. I think that is where that is the centralization of the placement of house officers. That is being done. I have met personally with the committees of CMDs. I've discussed with the Medical and Dental Council, and they say they were going to work on this to perfect it. It's a new beginning. This is the first time that house officers are being centrally placed. And we thought that was a good thing because we know that severally, many house officers many doctors had finished their training and they don't have a placement. You know somebody and then they will give you, or if you don't know anybody, you have no place. And if you do not do your house job, you cannot be registered as a a full-time doctor. You know, otherwise you remain temporary license. So you must get your full license after the house or have the job. But what we say is that this is being attended to, and very soon we believe that this will be resolved. But the lingering issues that have been on for some time, why do we have to wait until resident doctors say they are going on strike?
Interesting, Prof.
We in the NMA, we decided that we should go behind the scene to thinking that, and in our belief that negotiation, dialogue, advocacy would work.
Okay,
In
I
many
think one
areas,
issue.
not just
Right.
yes.
I think one issue that has been a bone of contention is whether or not NARD should suspend the strike while negotiation is ongoing or continue with the strike. I mean, the Minister of Health referenced the meeting they had just a day before the strike started and saying that, well, an MOA was put out. It was signed, you know, by representatives of the resident doctors, and, you know, it was meant to be taken back. So he was of the opinion that pending the time they reconvene and solve those issues, the strike should be suspended, and at least patients should begin to be attended to. Do you think that's a good idea?
Well, anything that will be done to suspend the strike action, NMA will favor it. But the issue is that the government should be prepared, you know, to ensure that they do the right thing. I think that is the issue that, and the Dr. NMA doesn't have any quarrel with it. Like I said, for the past 21 years, NMA has not gone on strike. But the issue is that the NRD is an affiliate of the Nigerian Medical Association, and we should be interested in what happens to them, which is peculiar to them. And even then, some of these are not even peculiar to them. Some of them extend to all doctors in this country. So what we need to do is government to demonstrate sincerity or purpose and be serious so that these things can be sorted out once and for all. And then we forget about issue of hazard allowance, or because doctors are leaving this country. Many more will leave unless the environment, the work environment is made conducive. Otherwise, they will go to where they are needed. Unfortunately, that is what will happen, because it will appear that those who are here are thought to probably have no option. But it's a sense of patriotism, the demonstrating sense of patriotism, and they should be reciprocated so that the right thing should be done, work environment should be made, patients will get the best of treatment that we can offer. And in that case, there should be no reason for anybody to emigrate. But the issue of brain drain is a very serious problem. And this will reflect in the next 5 years. Because in the next 5 years or so, many of us who are on the field would have exited the field. And those who should provide service are not there to provide the service.
Well, Professor,
so we should not take things lightly at all.
I think one of the, major points is the fact that you say the NMA is working behind the scenes to ensure that this strike ends, and would like to see, of course, the fruits of those works. But we'd like to thank you so much for joining us on the program this morning. Professor Innocent Uja is the president of the NMA. Thank you for your time.
Thank you very much. Thank you.